This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Zuvixa 2.5 tablet is an anticoagulant used for managing blood clots. It is crucial for patients undergoing surgeries or experiencing irregular heart rhythms. Indications and uses. This medication is indicated for the management of blood clots that form in the veins of the legs, as well as for preventing the formation of clots in patients with irregular heartbeats, particularly those suffering from atrial fibrillation. It is also utilized in preventing clot formation after hip or knee replacement surgeries and managing the recurrence of blood clots in both the legs and lungs. How it works. It functions by inhibiting factor XA, a crucial component in the blood coagulation process, effectively reducing the likelihood of clot formation. Directions for use. Take Zuvixa 2.5 tablet exactly as prescribed by your physician, swallowing it with a full glass of water. If you have difficulty swallowing, consult your doctor about alternative methods of administration. The physician will determine the appropriate dose and duration based on your specific medical conditions, age, and body weight. Possible side effects. Common side effects include various types of bleeding, bruising, anemia, and low blood pressure. If symptoms worsen, seek medical advice immediately. Precautions and warnings. Before starting treatment, inform your healthcare provider about any existing liver, kidney, or heart conditions. Pregnant or breastfeeding individuals should consult a doctor prior to use. It is contraindicated for patients with active bleeding or those who are allergic to any ingredients in the medication. FAQs. 1. Is Zuvixa 2.5 tablet a blood thinner? Yes, it is an anticoagulant that helps manage blood clot formation. 2. What precautions should I take? Inform your doctor about any pre-existing conditions, especially related to bleeding. 3. What if I forget a dose? Take it as soon as you remember, but do not double the dose. 4. Can it cause low blood pressure? Yes, low blood pressure is a possible side effect. 5. Is it safe during pregnancy? No, it is not recommended during pregnancy. Thank you for watching. If you have any questions or suggestions, please leave them in the comments below.